Welcome to Pinamonti Physical Therapy and Wellness Center. Today we're going to talk a little bit about dry needling. I'm going to go over what it is, and then I'll give you a demonstration of how we perform dry needling. So my name is Samantha Curran, and I'm a physical therapist here at Pinamonti's, and I have recently started doing dry needling here in Pittsburgh. I've been trained in it for about the last year and a half, and so we'll show you a little bit about what we can offer. Before we get started with all the description and all that fun stuff, I just want to let you know if you have any questions or anything, feel free to leave them in the comments, or you can always reach out to me privately as well. Also, don't forget to hit like and share on the video if you want to share it with any of your friends. So the first thing we want to go over is what is dry needling. So I have here a needle, and I don't know that you'll be able to see it very well. Right now it's in its tube. And so it's just a very thin needle. There's no gauge to it. And what that needle does is we just tap it into the skin to penetrate into a trigger point. So if someone comes to me like Nikki here, and they're having shoulder pain or upper neck pain, for instance, what I would do is I would hold on to those tissues, find that trigger point in that pain generator, and we would tap the needle right into that trigger point. Once we do that, it will elicit what we call a twitch response. And what that twitch response is the muscle kind of spasming a little bit to pump out those chemicals that are stored within a trigger point. So a lot of people ask who benefits or who would benefit from dry needling. There's multiple different diagnoses that we can treat. So we can treat patients with low back pain, neck pain, shoulder pain. We can also treat patients for headaches, plantar fasciitis, scar tissue. So there's really a wide variety of what areas of the body we can focus on. So now I want to give you a demonstration of what we are looking at with dry needling. So let me grab my gloves here. All right. So I'm going to slide around to the other side here, and on Nikki, we are going to needle her upper trap. So I'm just going to find a spot that's tender and let me know. Is that tender there? Okay. So we can kind of feel almost like a little bump under her tissues in that muscle tissue. So then I'm just going to tap the needle into those tissues and go straight into that spot. And I don't know if you can see or not, but that muscle is just jumping a little bit. And we just kind of fan that needle. Perfect. And then we take it away. And most of the time there's no blood. Every once in a while there's a little bit. You doing okay?
Yeah.
Okay. And so that's what we're looking at whenever we look at what we do for dry needling. So oftentimes people ask the question, what's the difference between dry needling and acupuncture? That's a question that I get pretty frequently. So the difference between the two is we do use the same needle, and that's really the only similarity. What we do with dry needling is we are going for a specific trigger point, whereas acupuncture is going more for the meridians. There's approximately 350 different acupuncture sites or acupressure sites. And so we aren't focusing on those points. We are focusing specifically on the muscle tissue or the connective tissue itself to get that release that we want based on the patient's needs. And whether that's for limited motion or pain or function to help improve the activation of a muscle. Another question I get is, do we need a doctor's referral? In the state of Kansas, we don't need a referral for patients to come in for dry needling. With dry needling, we don't bill insurance. It's $25 for a session, and patients can just come in, call and come in for an appointment for that. And the other question that we get a lot of is, does it hurt? How painful is it going to be? And I always tell patients that it depends. It varies on where in the body we are needling. Some areas are more sensitive than others, but typically it's a little bit sore when we get that initial twitch. And we might have some soreness afterwards that lasts about 24 hours. But that's really the only side effect of the soreness from dry needling. If anyone has any questions, again, feel free to let me know. You can call us here at the clinic at 620-235-1500, or you can email me at samantha@pinamontipt.com.